Have you ever walked into a doctor's office and wondered what they really think the moment you sit down? Most of us prefer not to dwell on that question. We want to believe the only thing running through their mind is how best to help us, how to heal us, how to solve the problems we bring. And in many cases, that is true. But doctors are human too, and behind the practiced smiles and professional words, some carry assumptions about older patients that quietly shape the care they provide. These assumptions are rarely spoken aloud, but they can make the difference between being fully heard and brushed aside, between getting the right treatment and missing a critical diagnosis. One of the biggest hidden truths about how many doctors see older adults is that they often assume our symptoms are just part of aging. Imagine this. You walk in complaining of fatigue, of stiff joints, or maybe lapses in memory. The doctor listens, nods, and then says something like, "Well, that's normal for your age." And in that one simple statement, your concern is dismissed, your symptom is minimized, and the chance for deeper investigation begins to fade. Yes, aging does change the body, but not every ache, every pain, or every shift in function should be written off as the inevitable price of growing old. I once heard about a man named Harold, who was in his early 80s. He began feeling lightheaded throughout the day. So tired, he sometimes needed a nap in the middle of conversations. When he brought it up, his doctor told him this was just what happened with age, that slowing down was natural. But Harold felt something wasn't right. He insisted on more tests, and eventually it was discovered that he had an irregular heartbeat caused by a valve issue. Once treated, his energy returned almost overnight. He wasn't just old. He was living with a correctable medical condition that had nearly been overlooked. This kind of dismissal doesn't always come from laziness or malice. Doctors face enormous pressure. Short appointment slots, long patient lists, endless paperwork. When they hear familiar complaints from older patients, it's tempting to reach for the simplest explanation. But simple isn't always accurate. By assuming symptoms belong to age, doctors sometimes miss treatable conditions like depression, thyroid issues, or even early cancers. And when those chances for early treatment slip by, patients end up suffering unnecessarily. It's a dangerous cycle. Once something gets labeled as just old age, the urgency to search deeper fades away. A cough that should raise alarms about the lungs is shrugged off. Weight loss is brushed aside. Dizziness is overlooked. And all too often, people are left struggling with issues that could have been resolved if only someone had looked a little closer. For older adults, this means one important thing. You must be your own advocate. Don't settle for answers that sound like brush-offs. If you're told, that's normal for your age, but your gut says otherwise, ask for tests, ask for explanations, and push for clarity. Your health deserves the same level of attention as anyone half your age. Being 80 doesn't make your concerns any less real. Another quiet belief that shapes care is the assumption that older patients won't follow through with treatment. Many physicians, often without realizing it, look at seniors and think, they won't remember all these instructions, or they'll have trouble managing a complex medication plan. Sometimes they even decide in advance that offering certain treatments would be a waste, because they assume the patient won't commit. But here's the truth. Many older adults are perfectly capable of following detailed instructions when given the chance. In fact, some are more disciplined about it than younger patients, precisely because they take their health so seriously. The danger is that if a doctor assumes you won't follow through, they may water down your options. They may simplify your care to the point where it's not the best possible plan, or they may avoid mentioning treatments that could truly help you because they think you won't want a hassle. I once met a woman named Janice, nearly 80 years old, who was diagnosed with a heart condition. Her first doctor gave her the most basic, stripped-down plan possible. A couple of pills and the suggestion to take it easy. But Janice wasn't the type to sit back passively. She wanted every chance to feel better, to stay active, to keep living fully. When she switched doctors, the new one took a different approach. He explained every available treatment option, gave her detailed written instructions, and even mapped out a plan for diet and exercise. Janice followed it all carefully and ended up controlling her condition far better than before. The difference wasn't her ability. It was how much her doctor believed in her ability. This is why it's so important to signal to your doctor that you're engaged and willing to put in the effort. Bring a notebook. Take notes. Ask them to write things down for you. Show that you are serious about following through. When doctors see that you are committed, they're more likely to treat you as an equal partner and share the full range of possibilities. Age doesn't decide whether you can follow instructions. Your determination does. A third truth is harder to talk about, but just as real. Sometimes, doctors prioritize younger patients. They may not even realize they're doing it. But when faced with limited time or resources, some instinctively devote more energy to people who are younger, assuming those patients have more years ahead, and therefore more to gain from treatment. That sounds cold, but in a busy hospital or clinic, this bias can creep in quietly. The problem is that it overlooks the fact that improving quality of life matters at every age. Relief from pain matters whether you're 40 or 80, regaining mobility, controlling symptoms, or extending independence is just as meaningful for an older person as it is for someone younger. But when doctors unconsciously prioritize youth, seniors sometimes get fewer follow-ups, less aggressive treatment, or even discouragement from pursuing certain procedures. Take the story of Richard, an active man in his early 80s who struggled with severe knee pain. His doctor told him surgery wasn't a good idea at his age, that it was too much to take on. But Richard wanted to keep walking, gardening, and living his active life. When he sought a second opinion, a different surgeon saw beyond the number on his chart and looked at his actual health. Richard got the surgery, recovered beautifully, and went back to enjoying the daily walks that gave his life so much joy. Age alone should never be the deciding factor in whether you get treatment. What matters is your overall health, your personal goals, and your willingness to take on the challenge of recovery. That's why it's so important to tell your doctor what you want out of your care. If your goal is to stay active, say it. If your goal is to travel, share it. If your goal is to live independently as long as possible, make sure they know. When doctors see your ambitions clearly, it shifts the conversation from how long you might live to how well you can live. And that small change can make all the difference. What all of this points to is something simple but powerful. Your doctor may walk into the room with unspoken assumptions, but you can change the script. You can challenge those beliefs by being clear, specific, and vocal about your health, your abilities, and your goals. You don't have to settle for being brushed aside, underestimated, or quietly deprioritized. The care you deserve depends on speaking up and showing that your health matters just as much now as it did decades ago. Think back to the last time you sat in a doctor's office. Did you feel like they really understood your concerns? Or did you leave wondering if they only gave you half an answer? For many older adults, the experience isn't about poor medical skill, but about quiet assumptions that influence the way care is given. And often, those assumptions have nothing to do with who you are as an individual. They come from stereotypes about age. One of those stereotypes is the idea that older patients aren't as interested in pursuing big goals anymore. Some doctors, often unconsciously, assume that once you reach your 70s or 80s, your only priority is to stay comfortable. They picture you resting quietly, maybe reading or watching television, and think the most you want from medicine is relief from discomfort. But here's the truth. Plenty of older adults have vibrant, active dreams. They want to garden, travel, dance, volunteer, even learn new skills. The challenge is that when a doctor assumes you only care about getting by, they may not offer the kind of care that helps you keep thriving. Let me tell you about Ellen. She was 81 when she started dreaming of visiting her granddaughter overseas. But she had a chronic lung condition, and her doctor told her forget about long trips, advising her to stay home and focus on staying comfortable. Ellen felt defeated until she found a different physician. This new doctor didn't just see her age. He saw her determination. He created a plan with targeted breathing exercises, medication adjustments, and advice on how to prepare for air travel. 6 months later, Ellen was boarding a plane with tears of joy in her eyes. That trip became one of the happiest experiences of her life. This story shows how important it is to speak up about your personal goals. If your doctor doesn't ask what matters to you, bring it up yourself. Tell them, I want to be able to walk my dog every day, or my dream is to attend my granddaughter's wedding next year. When you share those goals, your doctor can shape a plan that helps you reach them instead of assuming you just want to get by. Another overlooked truth is how much emotional health matters. Doctors are trained to focus on physical symptoms, blood pressure, heart rate, lab results. But aging isn't only about numbers on a chart. It's also about adapting to change, coping with loss, and facing new realities. Too often, doctors miss the emotional side. They don't ask if you're lonely, grieving, or feeling anxious. And when emotional struggles are ignored, physical health can quietly decline. Take Leonard, a man who had just lost his wife of 54 years. His health spiraled downward, and each appointment focused only on adjusting his medications. No one asked how he was coping at home. It wasn't until a neighbor encouraged him to seek counseling that things began to change. Once Leonard had support for his grief, his physical health improved too. His body wasn't just responding to medicine. It was responding to emotional healing. This is something many people don't realize. Your emotions can directly affect your body. Loneliness, stress, and sadness can weaken your immune system, disrupt your sleep, and slow down recovery. So when you visit your doctor, don't be afraid to talk about how you're feeling emotionally, not just physically. Saying, "I've been feeling down," or "I've been more anxious lately" isn't complaining. It's giving your doctor the full picture they need to help you. The good ones will understand that caring for you means treating both body and mind. But they can't know unless you tell them. The final truth is the hardest to face. Some doctors, even without realizing it, see aging as a slow decline toward the end of life. That outlook can make them less proactive about your care. Instead of asking, "How can we help this person thrive?" they think, "How can we make the decline less uncomfortable?" The difference between those two perspectives is enormous. Here's why it matters. If your doctor sees you as someone still full of possibility, they'll offer you opportunities, treatments, therapies, lifestyle changes that can add years of energy and joy to your life. But if they see you only through the lens of decline, they might limit those options, not because they're cruel, but because they assume you wouldn't want them. That's why your voice is so powerful. When you say, "I want to live fully," or "I still have things I want to do," you remind your doctor that your life isn't measured only in years left, but in the quality of the moment still ahead. I've met seniors who walked into appointments expecting to be dismissed, but walked out feeling empowered simply because they dared to be clear about what they wanted. They didn't let age define their future, and they didn't let assumptions dictate their care. So here's what you need to remember. Doctors may carry unspoken beliefs about older patients, but those beliefs don't define you. By speaking up about your symptoms, your goals, and your emotions, you can reshape the conversation. You can make your care about more than just surviving. You can make it about thriving. The next time you sit down in that exam room, picture yourself as a partner, not just a patient. Be specific, be honest, and don't be afraid to push for answers. Share what matters most to you, because your health, your story, and your dreams are worth every bit of attention and respect. And if you're still with me right now, I want you to do one thing. Leave a comment below and tell me one goal you want your doctor to know about at your next visit. It might inspire someone else to speak up about their own dreams. Imagine you're sitting in the waiting room, flipping through old magazines, maybe scrolling on your phone, waiting for your name to be called. The nurse finally opens the door, calls you in, checks your blood pressure, your weight, maybe your oxygen levels. A few minutes later, the doctor walks in, glances at your chart, and begins a routine. It all feels familiar, almost predictable. But here's the part most people don't think about. What you say or don't say in the next few minutes can shape the entire outcome of your visit. Doctors don't have hours to spend with each patient. Most appointments are 10 or 15 minutes at best. That means the way you use that time matters enormously. And yet, so many seniors walk in and fall into the same trap. They downplay their symptoms, they speak vaguely, or they say things they think the doctor wants to hear instead of the truth. These small missteps can cause big problems, because when doctors don't get the full picture, they can't give the best care. Let's start with the first mistake, saying, "I'm fine," when you're not. It sounds harmless, even polite, but it can be dangerous. Many older adults don't want to feel like a burden, so when the doctor asks, "How are you feeling?" they answer with a smile and a simple, "I'm doing okay." But if you're not sleeping, if you're struggling with pain, if you're losing balance or appetite, "I'm fine" hides those warning signs. Doctors are trained to listen, but they're not mind readers. If you minimize your struggles, they may assume everything is stable when it isn't. I think of Margaret, a widow in her late 70s, who hated complaining. Her daughter urged her to tell the doctor about her frequent dizziness, but Margaret insisted it wasn't worth mentioning. After all, she didn't want to seem weak. A year later, she fainted at home and fractured her hip. Only then did she learn the dizziness was caused by low blood pressure from her medication. Something easily fixed if she had just spoken up sooner. That broken hip changed her independence forever. The lesson here is simple. Honesty is not complaining. Your doctor needs the truth to protect you. Saying, "I'm fine" when you're not fine may feel polite, but it can cost you your health. The second trap is being too vague. Many seniors say things like, "I just don't feel right," or "I'm more tired than usual." While those are valid feelings, they don't give doctors enough to work with. The more specific you are, the better your doctor can help. Instead of saying, "I'm tired," try, "I feel exhausted every afternoon around 2 p.m., and it's been happening for the past 3 weeks." Instead of "my stomach hurts," say, "I get sharp pain in my lower stomach about an hour after eating, especially when I eat spicy food." That level of detail can be the difference between a doctor dismissing your concern and ordering the right test. Think about it like this. If your car makes a weird noise and you tell a mechanic, "It just sounds funny sometimes," how much can they really do? But if you say, "It makes a clicking noise when I turn left at low speed," suddenly they have something to investigate. Doctors work the same way. Details are clues. Without them, the mystery remains unsolved. The third mistake many seniors make is not mentioning changes in daily life. Doctors ask about pain, medications, and illnesses, but they don't always ask how those things affect your routine. Yet daily habits often reveal more than test results. If you start avoiding the stairs, if you stop cooking because it feels exhausting, if you cut back on social activities because of fatigue or embarrassment, those are signs of deeper issues. But unless you tell your doctor, they may never know. And if they don't know, they can't help. I remember hearing about George, who had slowly stopped driving at night. He told himself it was just safer that way, but he didn't mention it to his doctor. Months later, when he finally admitted it, they discovered he had cataracts clouding his vision. A simple surgery restored his sight, and he returned to his evening drives. Had he stayed silent, his world would have kept shrinking for no reason at all. So when you visit your doctor, don't just describe your symptoms. Describe your life. Tell them what you've stopped doing, what feels hard than before, what you're avoiding. Those little details may point to big solutions. The fourth mistake is assuming your doctor remembers everything about you. In reality, doctors see dozens of patients every week. They rely heavily on charts, but even charts don't always capture the full story. If you've seen multiple specialists, switch medications, or had tests done at different clinics, some of that information can get lost. That's why it's so important to come prepared. Bring a list of your medications. Write down your symptoms and when they started. Keep a small notebook of questions you want to ask. It may feel old-fashioned, but it works. Not only does it help you remember, it shows your doctor that you're serious and engaged. And when doctors see you taking charge of your health, they're more likely to take your concerns seriously too. Let me give you an example. Claire, a 79-year-old retired teacher, kept a journal of her health. She wrote down when her headaches occurred, what she ate, how she slept, and even how stressed she felt. At her next appointment, she handed the notes to her doctor. Within minutes, the doctor noticed a pattern. Her headaches always follow nights of poor sleep combined with too much caffeine. By adjusting her habits, Claire dramatically reduced her pain without needing heavy medication. Without that notebook, the connection might have been missed. The fifth mistake is something many seniors don't even realize they're doing. Trying to be a good patient by staying quiet. They don't want to argue. They don't want to push back. And they certainly don't want to seem difficult. But staying quiet when you're confused or uncertain is the quickest way to miss out on the care you deserve. If your doctor explains something you don't understand, stop them. Say, "Can you explain that in simpler terms?" If they recommend a test or a treatment, ask, "What are the risks? What happens if I don't do it? Are there alternatives?" Those aren't rude questions. They're smart questions. A good doctor will respect them and answer them. Remember, this is your body, your health, and your life. You have every right to understand what's happening. Staying silent may feel polite in the moment, but clarity could save you from unnecessary procedures, side effects, or even life-threatening mistakes. And finally, there's one more mistake that almost every senior makes at some point: not sharing their true priorities. Too many people assume the doctor knows what matters most, when in reality, doctors only know what you tell them. If your goal is to stay independent, say that. If your goal is to avoid nursing homes, say that. If your goal is to have enough energy to play with your grandkids, make it known. When doctors understand your priorities, they can shape your care around what truly matters to you. Without that knowledge, they may focus on numbers, blood pressure, cholesterol, test results, without realizing what you really want is quality of life. So here's the big truth. Doctors may hold assumptions about aging, but you hold the power to shape how they see you. By speaking honestly, specifically, and clearly about your symptoms, your life, and your goals, you break through those stereotypes. You transform the appointment from a routine checkup into a partnership. The doctor may walk in with their own ideas, but you can walk out knowing you've been heard. And when you're heard, you're more likely to get the treatment, the respect, and the solutions you truly deserve. So the next time you're in that small room with the white walls and the fluorescent lights, remember this. Your voice matters more than you think. Don't minimize, don't stay vague, don't hide the truth. Speak up, because the way you talk at the doctor's office could be the difference between being dismissed and being cared for. And at this stage in life, every moment of health, every ounce of energy, every piece of independence is worth fighting for.